Hi, I'm Lacey Cornelson. I work at the Kansas State University Center on Aging. I'm a social worker and long-term care administrator, and I currently work with nursing homes in Kansas to implement person-centered care practices. Today, I'm going to discuss the issue of transitions to long-term care supports and services. So as we explore transitions, we're going to look at how to make those transitions more person-driven. We're going to look at the spectrum of long-term care supports and services that are available out there. We're going to look at resources to help select the right place. We're going to look at payment sources for care and how to improve the transition itself when it actually happens. So first, let's talk about the person driving the transition. I want you to think a minute about yourself or your parents and consider that at some point you might be the one that's going to help assist them or yourself in accessing long-term care supports or services if they're needed. Right now, maybe if I'm thinking about my own parents, they travel, they're socially engaged, they keep up their own home, they go to family activities and grandkids events, they have people over. So it's one of the last things I'm thinking about to actively be looking for long-term care services or supports. That being said, at any given time, the risk factors for various types of diseases and illness do go up as people age. So once you reach around 60, 65, some of those more significant disease processes, the statistics go up for those things. So we want to make sure we're thinking about what the options are and what's important to the person before the crisis. Because when the crisis comes, if nothing has been thought about, then you have to have some really tough conversations in an already stressful situation when the options become more limited because of time constraints. And so if you've had the opportunity to talk about these things in a lower stress environment, when a person can be involved in those discussions, because for instance, if the person needing long-term care supports and services has just had a stroke, their mind may not work well enough to participate in that discussion. But if they were able to participate in the discussion earlier, then it would be something you could draw upon during the crisis event to think about, okay, what did mom or dad say that they wanted if this were to happen? So some questions to ask as you're having this discussion are, what's important to you if your health or needs change? What resources do they have to support those preferences? Like, do they have insurances? Do they have money saved back? Just what are those resources that might be available to pay for long-term care supports and services? And who do they want as their advocate to support those preferences? Those are things like healthcare directives that you might need to set up in preparation for a time when maybe they can't make decisions for themselves. So it's good to do those things before the crisis actually happens. So what are the options out there for long-term care supports and services? This diagram really gives you an idea of all the things that are available. And as you look at it, those services that have the least level of care and supervision are on the left side of your screen. And then as you go to the right side of your screen, the supervision increases. And then in terms of cost, those at the bottom of the screen are less cost, whereas those at the top of your screen are higher cost. And the combination of these things then also drives up the cost. And I think what's really important to remember here is it doesn't have to be all or nothing. So for instance, you can be in your own home and still be receiving things like respite care and in-home senior care services. You might do a blend of adult daycare and in-home services, or live at home and have hospice care. So there are a lot of different combinations here. Assisted livings even use some in-home care if the level of care in the assisted living isn't quite enough. So it's important to know the different types of things that are out there in your area. And then with all of these different long-term care support services, I'll call them LTSS from here on out, they traditionally have been built upon the medical model of care, which came about because of hospital care. And so regardless of where the care is delivered, it's traditionally been based on efficiency and not individual preference, focused on illness instead of the person, hierarchical in structure, where people have to report up to the person above them, a rigid structure that is focused on regulatory compliance and safety. More and more, we're realizing and recognizing, especially as we move away from COVID a little further, that when people are isolated and they don't have that social, holistic perspective surrounding their care, they lose a lot. Their health can decline a lot. So the social emotional part is as important as the more clinical or medical part of care. And so person-centered care models are becoming more and more of the norm. We have a lot of work to do as a nation to even get better with that, but in this model, it's based on individual preferences and routines. It focuses on quality of life as well as quality of care, especially meaningful living. And then for staff members in these kinds of environments, it's about team decision-making versus that hierarchical structure, and also developing and growing people in those positions. So here in Kansas, we have a program called PEAK that is a Medicaid pay-for-performance program that incentivizes and provides support for nursing homes wanting to implement person-centered care. So I included some resources here around that. It helps organizations break down old systems that support that medical model and help build up new systems to support the person-centered care model. But person-centered care is a nationwide movement, and so there are a lot of different resources that you can look into for how to look for person-centered care in an organization, and the Pioneer Network is a great one. And there's also a tool, and these are all included in the references for this, called the Artifacts tool that helps you look for specific things that are person-centered. Some other selection resources that are really helpful when you're trying to find that right fit in a nursing home are things like state-specific ratings. In Kansas, that might be PEAK. In Minnesota, they have a scorecard. So there's different types of things in different states. Nationwide, there's something called the 5-star rating system or Nursing Home Compare. And it actually helps you search for more than just nursing homes, but the nursing home side of it has a 5-star rating system for them. You can also look for regulatory compliance reports. These would be when a organization receives their health and safety inspection, it's a public. And so you can go look for a specific home that you're considering for a loved one and see how they did in terms of regulatory compliance. I never encourage anyone to select a place for a loved one based on only one thing, because they only give you one picture of things. You want to look at it more holistically. And while it's very important that homes avoid deficiencies, it also may be something that's not as severe as one might think, because when you work with people and you have a complex environment like a nursing home, there are so many things that they're ticking off to be in compliance with. And so it's not so important to look at the number of deficiencies a home gets, but why? What did they get those deficiencies for? And so these kinds of reports help you kind of investigate that a little bit. In-person visits are really important. I always encourage you to go so you can get a feel for how it is there. What are the noises like? How do the people greet you? How are other residents treated? How are staff members treated? And there's a tool that can help guide your visit if you go do that. And whenever possible, it's really helpful to involve the person needing care in these visits, whatever level of care it is. Local area agencies on aging also have lots of information. And in fact, if you are using Medicaid to help pay for care, they're also the ones that do what's called a care assessment to assess for need for long-term services and supports. Word of mouth is a great way to find out if a place has a good reputation or not. People who lived there, interacted with your organization, find out their thoughts. And then go directly to the service and support website or social media sites and see what you can learn from them. So as we think about not only selecting a place, but then paying for it, I kind of wanted to share some statistics here. So over a person's lifetime, 7 in 10 people over 65 and older will need long-term services or supports of some kind. That does not necessarily mean that full and spectrum of skilled nursing care, but some type of support or service, 7 out of 10. So it is important to have these conversations and to consider that. And in terms of paying for long-term care, Medicaid is still by far the most predominant source of pay for long-term services and supports. And that used to be heavily spent on nursing home care, and now more and more is being diverted to community-based care. So we're seeing a lot more of that. It's important kind of to know, especially with public funding, what do those sources pay for in terms of long-term services and supports. And Medicare generally does not pay for community-based services. And here's why, because it's that emergency medical type of coverage. And so in terms of long-term services and supports, it only pays for acute illness or injury up to 100 days. Not all settings take Medicare. They have to be certified for Medicare. Now, a lot of nursing homes and rehab facilities do take Medicare because that's one of the things they specialize in, but not all do. So it's important to understand that. But somebody who just needs custodial care would not qualify for the Medicare payment portion. Now, Medicaid is that largest payer for long-term services and supports, but it is need-based. So it's a spend down situation. And there is a look back period. So I think about my own grandparents who were in their almost 90s, and they just never thought that they would need long-term care. And they had land and a farm and stuff like that. And so their thought they would just pass it down to their kids, and then they go to the nursing home, no big deal. But you cannot pass down those assets right before you go to the nursing home and get out of it. There's a look back period for when you transfer assets to, say, heirs. And if it's within a certain window of time, they can take it back as a part of your assets. And so it's important to think about those things and think about financial management and trusts and things like that to help to look at holistically at your financial picture and what's going to be most helpful if you were to need those services and supports and have them paid. Private pay is also a big one, just out of pocket payments. A lot of people do that until they spend down assets and then they receive Medicaid to help. Long-term care insurance is another big one. It is one that's important to investigate that it's a right fit for you. So just really investigate those policies. It has been traditionally one of those things that's been a source of fraud for older adults. And so it is improving in that area, but we definitely want to make sure that the policy you get matches your need. And then managed care plans. And these are really where you sign up for a plan that travels with you over time. And a more public form of that is PACE. So there are other forms of that as well. So once the person needs long-term services and supports, how do you make that transition better or easier for the person? I think it's always good to involve the person from the start whenever possible, and connect with staff persons that are actually going to be taking care of the individual prior to the transition itself. So if it's an in-home person, have a meeting before the actual first day. Like, for instance, let's say you're having a home health aide come in to give a bath. It would be great to have an interaction first to find out a little bit about each other before they come and give the first bath, because that's kind of an intimate caregiving task. And so just getting to know and build relationships with those staff persons prior, and then sharing information about routines, preferences, goals, and expectations. That helps both parties really kind of get a picture of what's possible, what the expectations are, and also helps staff members who are going to care for the person understand who they are, what makes them tick, what time do they like to get up, what do they generally eat, what are their patterns. Just gives them a heads up. If moving into a new place, try to personalize that space with a person's own belongings to help it feel familiar and have that those sensations of home. Connect and visit with a person often in the first weeks or months. So if it's your loved one that's moved somewhere else, stay connected with them through that transition time. It kind of used to be standard of practice, especially with dementia, that you don't speak to the person, you don't visit for 2 weeks. That is a passing thing, and it's not really shown that it has benefits. It's better to stay connected with that person. Also, as a caregiver, foster connections with others living in that new setting, help your loved one foster those connections, and encourage the living setting to also foster connections. And then ensure access to important things to the individual, things like pastimes, hobbies, communication devices, so they feel they can continue to stay connected. And with all these different things, though it feels a little overwhelming, if there's some forethought into this can really help that transition that may be very much needed to go smoother, and that the person can have a quality experience.